I come from a family that has been affected by addiction for generations.
Growing up, I didn't know my dad like I do today. He suffered a life of pain, masked under the heavy cloak of chronic prescription opioids.
He was prescribed OxyContin and morphine after his accident, and for years after that, he stayed dependent on those painkillers, mixing them with alcohol and retreating away from his previous life and away from his family.
It's been 4 years now since I got that gut-wrenching text message. Evan was gone. His baby, only 2 years old at that time, would never remember his laugh, would never know his smile.
I always admired my uncle's energy, athleticism, and bravery, his quick cleverness and street smarts. However, at a young adolescent age, he started using different substances, joined a gang, and was in and out of jail. My grandmother and the rest of the family held on to hope that he would turn his life around, but he never got the treatment and true help he needed.
Although no one would say the words overdose, it became more and more obvious that this must have been what took the life of such a creative and determined young man much too soon. It is what takes the lives of so many too soon.
I work in a county hospital as well as a tertiary referral hospital and see patients without insurance as well as those with. I see substance use disorder at both hospitals because it does not discriminate.
As a student interested in emergency medicine, I saw an overdose on almost every shift. But what surprised me was how normal and procedural that event had become. To me, the opioid epidemic is everywhere. At nights, when I walk my dog, I worry so much about the thought of an overdose that I've carried Narcan.
It's time to stop blaming addicts for their addictions and start offering people a caring hand.
Almost 90% of the 21.5 million Americans that struggle with substance use disorder report needing but not receiving treatment.
It has always been a health issue, but in America we haven't always addressed it as a public health problem at all. Instead, we've chalked it up to a moral failing, and we have, in countless cases, criminalized it and placed blame when we could have offered help.
Our IHI Opisco substance use campaign is about working together. Students, healthcare professionals, and others in local communities fighting the problem and consequences of substance use worldwide. But it is also about engaging in the collaborative work by being mindful of the complexity and deep-rooted inequities that have shaped the circumstances influencing substance use disorders.
We can raise our voices in opposition of this suffering. We can collectively join together and take action to help others, to find a way out from under this heavy cloak.
We have the chance to change systems so that from here on out we address all addictions for what they are: preventable, treatable, chronic, and relatively complex diseases that people can and do recover from.
We can be part of a solution for our communities, for our own loved ones, for ourselves. I hope you will lend us your voice and join us.
Together we have real opportunity to create change as the open school.
To allow everyone to get an opportunity at realizing their dreams.